Good morning. You know, Intel's been a strong supporter and contributor to a lot of open source projects over the years, projects like Linux and OpenStack, Hadoop, and more recently Spark. And at Strata, we're here to introduce you to a new open source project for data scientists and developers called Trusted Analytics Platform. And we're revealing some of the organizations who we're engaging in that first wave. And one such organization that we've been working with for the past year is Penn Medicine. And these guys are doing some amazing work in identifying and improving the detection and diagnosis of really serious health issues. So what I thought I'd do is invite a friend of mine on stage to tell you a little bit about their work and how TAP aligns to their vision. So I'd like to introduce Mike Draugelis, who's the Chief Data Scientist at the University of Pennsylvania.
Thanks, John. So I'm going to start with how I got here. In 2008, my son was born. And in that delivery, my previously healthy wife hemorrhaged and went into shock. Caught the clinicians totally off guard. They rushed to apply new devices, new medications, but ultimately, we waited in that OR for 5 hours to see if she would respond. And she ultimately did. That's her right there with my little chubs. But my background in missile defense, I couldn't help but think that there was some early warning that we could have provided the clinicians. There was some hidden signal of this pending event. And that experience stayed with me for a long time. So when the chance came for me to work at Penn Medicine, I jumped at it. And when I got there, we focused in on two of the biggest problems in healthcare: sepsis, a blood infection that can cause the body to shut down, 10th leading cause of death, and heart failure, leading cause of death. Both of these diseases are incredibly difficult for clinicians to stay ahead of, to find the signs of it coming. For sepsis, half the patients in the hospital exhibit signs of it, while only 1% are truly at risk. And for heart failure, half the heart failure patients in the hospitals can go undiagnosed, missing a chance for education and potentially life-saving treatment. And why is that? There's amazing medical research done in both these areas all the time. There's a lack of a physiological model, a lack of a physical model that's meaningful, that we can pump all your information into to explain to the doctors what's happening. So what do you do in the lack of a physical model? You build a data model. But you need mountains and mountains of data. So at Penn, we have 25 million patient encounters, each with hundreds or thousands of vitals. We have 25 terabytes of radiology data, tens and tens of terabytes of clinical notes. It goes on and on. It's a nerd wonderland, and we're hiring. But we have a complete devotion to open source. Open source has paved the way in innovation and adoption, which is incredibly important for us, and especially so in big data. But we work to reduce the barriers for our data scientists so they can focus and embed themselves with the clinicians. Because we need to find out if our new insights are deep and meaningful, and if our predictive alerts can be delivered at the right time in a way that they can act. And so to do that, we created this real-time predictive application platform called Penn Signals. It takes this huge variety of data, mixes it together into this quantitative model, and gives our data scientists a kickstart in working with the clinicians. So with this model, we've taken alerts from 2 hours before a patient goes into shock to 30 hours before, changing the landscape for the clinicians. And for heart failure, we're engaging 20% more patients in the hospital where they can get educated and informed on new treatments. But we're also finding the patients that are most at risk. But in this next coming year, we're expanding out to wearables for our patients, Internet of Things, and we're going to move on from prediction to auto-reasoning. And my data scientists need an environment that they can build quickly, select their analytic tools at scale, and a platform that can support it. And that's where we've been excited to work with Intel to explore this new open source project called TAP that could allow our data scientists to do just that. And we have some early proof of concepts that have created new signals that we're feeding back into our algorithms. So you can go down to the Intel booth. We have some demos down there from the teams that worked with my team, and they'll be happy to answer any kind of questions that you might have. Thank you very much.